Before we begin, let me ask you this. Have you ever held your crying baby and felt lost? You fed them, you changed them, you rocked them, but they still cried? If yes, you're not alone. Every new parent goes through this. And today on Mommy Guide Baby, I'm going to walk you through the exact reasons why babies cry and how you can calm them fast, safely, and gently. By the end of this video, you'll understand your baby on a whole new level. Script starts. Crying is the only way a newborn can communicate. They can't talk, they can't point, and they can't tell you what's wrong. But trust me, every cry has a meaning. Once you understand the signals, calming your baby becomes much easier. Let's start with the most common reason. 1. Hunger cry. Hunger is the #1 reason newborns cry. Hunger cries usually start soft, then get louder and more rhythmic. Before crying, babies show hunger cues like rooting, sucking their hands, or turning their head side to side. Fast way to calm: feed them right away, breast milk or formula, whichever they're on. Responding early prevents the cry from escalating. But what if your baby just ate and still cries? Let's move to reason number 2. 2. Gas or tummy discomfort. Newborn digestive systems are still developing, and trapped gas can make them extremely fussy. A gas cry is more intense, and babies often bring knees toward the chest or arch their back. Fast way to calm: burp after every feeding. Hold baby upright for 10 to 15 minutes. Try gentle bicycle leg movements. Use a tummy massage in circular motion. Sometimes just a good burp is all they needed. 3. Wet or dirty diaper. Some babies can tolerate a dirty diaper for a while. Others want it changed immediately. A diaper discomfort cry usually sounds whiny and irritated, not intense. Fast way to calm: check the diaper and change it right away. Make sure wipes are warm because cold wipes often make crying worse. For baby is over. This is a huge one. When babies become overstimulated, too much noise, lights, people, or activity, they can't settle themselves. Their overtired cry is usually fussy, broken, and accompanied by rubbing eyes, yawning, or turning their head away. Fast way to calm: reduce noise and lights. Swaddle. If they're under 2 months, hold them close. Use slow, rhythmic rocking. Overtired babies need calm, not stimulation. 5. Baby wants to be held. Human babies are biologically wired to cling to caregivers. It's not spoiling, it's nature. If the cry becomes softer as soon as you pick them up, they simply needed closeness. Fast way to calm: hold, cuddle, skin-to-skin contact, or use a baby carrier. Your heartbeat and warmth instantly relax them. 6. Temperature issues. Newborns can't regulate their temperature well. They may cry if they're too cold or too warm. Fast way to calm: feel the back of the neck, not hands or feet. Adjust clothing layers. Ensure the room temperature stays around P-72 degrees Fahrenheit, Y-22 degrees Celsius. 7. Need for burping after feeding. Sometimes babies cry during feeding because they swallowed air. Fast way to calm: pause feeding, burp them, then continue. Try different burping positions: shoulder sitting up or face down on your lap. 8. Growth spurts and cluster feeding. Around 2 to 3 weeks, 6 weeks, 3 months, and 6 months. Babies cry more because they want more milk and more attention. Their body is growing rapidly. Fast way to calm: feed on demand. Cluster feeding is normal and temporary. 9. Colic crying. If a baby cries for 3 hours a day, 3 days a week, for 3 weeks straight, it may be colic. Colic cries are intense, high-pitched, and hard to soothe. Fast ways to calm: hold baby upright, swaddle, white noise. Car rides. Reduce dairy if breastfeeding sometimes helps. Use anti-colic bottles if bottle. Remember, colic is stressful, but not dangerous. It usually improves by 3 to 4 months. 10. This happens when babies get too much sensory input. TV noise, people talking, bright lights, or loud environments. Fast way to calm: move to a quiet, dim room. Hold baby close to your chest. Speak softly or use gentle shushing. 11. Understimulation or boredom. Yes, babies get bored too. If your baby isn't tired, hungry, or uncomfortable, they may simply want interaction. Fast way to calm: talk to them, show contrast cards. Let them look around. Give tummy time if they're awake and alert. 12. Teething pain for older babies. Around 4 to 7 months, teething can cause crying, drooling, and chewing on hands. Fast way to calm: a cold teething ring. Massage gums with clean finger. Extra cuddles. Avoid teething gels unless pediatricians. 13. Baby is just communicating. Not all crying means something is wrong. Some babies cry briefly before sleeping or transitioning between activities. In this case, The cry is a way of releasing energy. How to calm a crying baby, fast mom-tested methods. Now let's focus on the quickest and safest calming techniques. 1. The 5S method, used by pediatricians worldwide. S number 1, swaddle. Keeps baby secure, reduces startling. S number 2, side or stomach position only for soothing, not sleeping. Hold baby on their side in your arms. S number 3, white noise mimics the womb. S number 4, swing gentle. Small movements, not big shakes. S number 5, suck. Pacifier or clean finger for comfort. These 5 steps calm most babies in seconds. 2. Soft singing or humming. Babies recognize their mother's voice from the womb. A simple lullaby can instantly relax them. 3. Dim the lights. Bright rooms overwhelm newborns. Lowering lights signals safety and calm. 4. Skin-to-skin contact. Bare chest to baby's cheek or chest regulates heartbeat, breathing, and temperature. 5. Use rhythmic motions. Bouncing lightly on a yoga ball. Swaying while standing. Babies love rhythm. It reminds them of the womb. 6. Check for signs of sickness. If your baby cries nonstop, has a fever, or seems unusually sleepy, always contact a pediatrician. Remember, crying is normal. It doesn't mean you're doing anything wrong. You are learning your baby, and your baby is learning you. Every day you grow stronger together. If this video helped you understand your baby better, make sure to subscribe and share. This is Mommy Guide Baby, where every mom is supported, every question matters, and every baby is loved.